If your horse has a long curly coat, keeps getting bouts of laminitis, and looks like they're aging too quickly, this may not be just your horse getting older. This could be Cushing's disease. And missing the signs can cost your horse not only their soundness, but in extreme cases, their life. So what is Cushing's disease? Cushing's disease, also known as PPID, which stands for pituitary pars intermedia dysfunction. You can see why we abbreviated it, is a endocrine disorder, also known as a hormonal disorder, where part of the horse's brain starts to malfunction and overproducing hormone. This throws the entire body out of balance, especially when it comes to insulin unity and metabolism. So basically, the brain keeps telling the body to produce stress hormones, even though your horse doesn't need them. So how do horses get this mysterious health condition? It's most common in older horses. Usually horses will develop it in the early to late 20s. But we're seeing more frequently horses around the 15-year age mark developing Cushing's disease. It's important to understand that it's more common in older horses, but age alone doesn't actually cause it. Cushing's disease happens when a benign tumor starts to grow on the pituitary gland, which is a tiny little gland in the horse's brain. This gland is called the master gland because it does send signals to the rest of the glands telling them what to do. When a tumor is growing on the pituitary, it is sending signals to release hormones that do not need to be released. The nerve cells that control hormone production degenerate over time in a horse that has Cushing's disease because the tumor keeps growing. While Cushing's disease is more commonly seen in horses who are middle to older in age, if your horse has existing metabolic issues, is an easy keeper, maybe it has insulin resistance, or is a chunky pony, they are also at an elevated risk to develop this disease. Now, Cushing's disease is not caused by nutrition, but nutrition can make it worse. So if your horse has this, don't feel bad. It's not something you caused. It is absolutely manageable. So we've established that Cushing is a result of unchecked hormone release. What's the big deal, you might ask? So characteristically, you will see horses that have Cushing's having very long, thick, even curly coats that do not shed in the warmer months. You'll notice muscle degeneration. You'll see muscle atrophy. A lot of horses will get a little bit of a sway back as they lose their top line. But the physical appearance isn't the issue. It's what's happening underneath that we need to be concerned. High impact complications that can happen as a result from your horse having Cushing's disease is recurrent or unexplained laminitis. Now, it's important to understand that the muscles are what makes the body susceptible to the hormone insulin. If you have muscle loss, as is the case with horses with Cushing's disease, it is harder for them to regulate and respond to the insulin. So more insulin is created because we're not responding to it, and it just goes sky high. When the horse has too much insulin in the bloodstream, the blood vessels constrict. Now, the tissues in the horse's hooves are very intricate and the vessels get pretty tiny down there. So if they constrict, it significantly reduces the blood flow being delivered to the horse's hooves. And we all know blood delivers nutrients and oxygen. So over time, this damages the lamina, which is the soft connective tissue inside of the horse's hoof, connecting the pedal bone, also known as the coffin bone, to the hoof wall. When this tissue dies, it detaches, it inflames, and it's super, super painful. And in a lot of horses with Cushing's, they end up having to be humanely euthanized because the laminitis is so bad. Horses are also prone to get chronic infections. If they have Cushing's disease, you'll see weight loss due to muscle atrophy, which is muscle wasting. At the same time, you'll see abnormal fat accumulations or fatty deposits along the horse. A lot of times you will see it in the horse's crest, the horse's top of the neck. When it advances, your horse might become lethargic. You might see some personality changes. So as you can see, it's a pretty big deal. To determine if your horse has Cushing's disease or not, you should reach out to a veterinarian who will come out, do a physical exam, get an overall picture of what's happening with the horse, and they will do a blood test as well to see how the horse responds to a synthetic hormone. Now, it's important to note that sometimes the blood work does not reflect Cushing's disease because you can have what's called pre-Cushing syndrome. If you're insulin resistant, you can potentially reverse the pre-Cushing syndrome with good nutrition. But unfortunately, once your horse is diagnosed with PPID, they've got it, and there's nothing to cure it, just managing it. Often symptoms of Cushing's disease appear before blood work can reflect what's happening internally. So as I said, Cushing's disease is not curable, but it is manageable. The first line in managing Cushing's disease is going to be medication to control hormone production. Strict nutritional management to help control those insulin spikes is very vital because, as I mentioned earlier, insulin spikes trigger laminitic episodes. You're going to have to routinely monitor and adjust your horse's lifestyle. Some horses cannot eat any grass whatsoever. They have to have their hay soaked to reduce the sugars. Many can't tolerate treats. So as it progresses, because the tumor is going to continue to grow, you will have to change your horse's diet. That's going to look like decreasing the sugar. So I don't want to scare anybody out there if your horse has been recently diagnosed with Cushing's disease, because with proper management, horses can live many, many, many years and do so comfortably. The prognosis for Cushing's disease really depends on how early you caught it. It also depends on how seriously it's managed. If your horse is on medication, but on 10 acres of lush green pasture, no amount of hormone regulation is going to be able to combat the insulin spikes that having access to that much sugar causes. So an early diagnosis paired with an excellent quality of life, so managing pain, being on medication to regulate hormone production, curbing insulin spikes by limiting what they're eating, goes a really long way in making sure that your horse is happy and healthy. In this series, I'm breaking down a multitude of nutritional disorders that every horse owner needs to understand, because most of these disasters are preventable. If you're not sure if your horse is just getting older or if there's something else going on, this is when you need to get your vet involved and take a closer look. Managing your horse's diet can be huge and instrumental in their overall wellness and longevity. And I know there's a lot of nuance when it comes to nutrition, a lot of opinions out there, a lot of contradicting information exists on the internet and in textbooks. That's why I created the No Guess Horse Feeding Guide. It consists of 4 flowcharts. Flowcharts are pretty fun, and you just follow the prompts, answer the questions, and then it gives you a recommendation on what you should feed your horse, and it comes with a hay feeding guide and a grain feeding guide. So if you want that, I'll put the link in the description. The link is also in my bio. Go ahead and check out the No Guess Horse Feeding Guide. It's pretty useful tool out there, especially when used in conjunction with veterinary care. If you found this video helpful, give it a like, subscribe, and I'll see you next week with another horse care video. Bye for now.